begin tonight with breaking news at 6 o'clock, what could potentially be a very dangerous situation from Kaiser South, the hospital in South Sacramento, where they now confirm that a patient who was admitted may have been exposed to the Ebola virus. Now, Kaiser and the Sacramento County Division of Public Health are working together at this hour, we are told. The Centers for Disease Control and Prevention has been called in. We are told they will be testing blood samples in the upcoming days. The hospital's personnel drew a sample of the blood. The county's public health lab has sent that sample now to CDC to detect whether or not the Ebola virus is present. The outcome of the test is expected in several days, depending on CDC protocol, we are told by officials. Now, we want to read for you a statement that we received just moments ago from Kaiser public relation officials. In order to protect our patients, staff, and physicians, even though infection with the virus is unconfirmed, they write, we are taking actions recommended by the CDC as a precaution, just as we do for other patients with a suspected infectious disease. This includes isolation of the patient in a specially equipped negative pressure room and the use of personal protective equipment by trained staff. They went on to write, this is coordinated with infectious disease specialists. This enables the medical center to provide care in a setting that safeguards other patients and medical teams. Now, tonight we're getting some answers about what exactly Ebola is to get you caught up to speed. This is according to the World Health Organization. The Ebola virus is transmitted to people from wild animals. That's what we know thus far. Fruit bats are considered to be a natural Ebola host. The virus has a 90% death rate. The Centers for Disease Control says that patients can also experience difficulty breathing and swallowing if they come down with it, and internal and external bleeding. But again, I spoke on the phone with an assistant from Dr. Stephen Perotti. He is an infectious disease specialist. He is located in the Bay Area. He works for Kaiser Permanente. He is the man who sent out this press release. He was not available to talk on the phone with us here at CBS 13 for this newscast. We have reached out to the Centers for Disease Control. We have reached out to the Sacramento County Health Department. We have also reached out to state health officials, none of whom are available for any type of interview thus far, with the news that there could be a patient at Kaiser Permanente who has been exposed to the Ebola virus. Now,